Good morning. My name is Diana Mangu, and today our topic is going to be about the code of ethics. In the code of ethics, we have patient relations, physician-provider relations, physician activities, billing for services, political activities, conflict of interest, communication, health and safety, compliance program, and the privacy of the patient. Our number one concern is our patient in terms of their well-being, dignity, and comfort. We provide them with service and care that is medically required, that is medically necessary, and we have to do it in an appropriate and respectful manner with dignity and professionalism. We have to take note or be aware of their race and ethnic background, sex, religion, color, and the nature, origin, age, and disability. We also take into consideration veteran status, marital status, and their ability to pay. We must serve them with compassion and committed to treat our patients like we want to be treated. And physician-provider relationship, the relationship between physician and provider must be confidential. We also accept patient referral and admission based on their needs. In other words, patient has a right to refuse treatment. We also accept them based on the ability to render the required services. Physician activity. The physician activity should be checking on the patient periodically when they are in the hospital, making sure that they are comfortable, and not only that, but help. Making sure that their needs are being met, both physical and mental. Billing for services. Sending the patient's bill to the insurance company, we must proofread it and make sure that all appropriate procedures are listed at the right site and the right place. All surgeries are proofread before sending to the insurance company. In political activity, we should be able to separate personal and hospital politics activity in order to comply with accurate, appropriate rules and regulations having to do with lobbying. We shouldn't let those overlap. Sometimes we may have to ask employees to contact members of the government to write letters to present our position based on certain issue or to do something to promote interest. In other words, in other words, as an advocate for patients, we sometimes need to get involved with the government or federal agents based on the needs of our patients. Conflict of interest, this happens all the time and occur if outside activity gets in the way of our ability to be objective and make those decisions for our job responsibility. Again, conflict of interest. We should not let our outside life interfere with patient care. We should always put our patient first, every day, every minute. Communication. Communication is very important, including in media, emails, internet, voicemails, and more. we should use these form of communication for business and professional use. Con- Confidentiality is a must when communicating with a patient. In other words, we must have patient authorization to send them email. Voicemail should be basic information, and whatever information you're giving to social media should also be should be aware not to violate the HIPAA Privacy Act. Communication should also include or could include chains of letters, appropriate messaging, avoid harassing, threatening, or anything that will harm the patient in any way. We should not be copywriting documents or doing job searching when we're on the job. It should be strictly patient care. Health and safety of our patient. Health and safety should be a commitment. We should be committed to provide a safety and healthy place for our patient as well as our employees. We must have our facility up to date, comply with federal and state and local regulations, promote the protection of health and safety of our patient and our employee from any kind of diseases. We must follow OSHA rules and regulations. Compliance program. This is a program containing a code of conduct that outline the appropriate behavior followed by all employees. This is the building block and center of the program is to help employee make the right decision and ask the right questions, which will enhance the care of our patients. Privacy. Privacy is important to both the physician and the patient. The patient have the right to keep their privacy secure and can reveal any information if it helps them with critical needs. Furthermore, the physician in turn of their job can keep their private stuff private too. In other words, privacy is a must. Patients have the right to their health care being in private and confidential. Physician has the right of keeping their private life to themselves. Thank you very much.